start, let me ask you, do you have any idea what is hypovolemic shock? So, first, let me tell you what shock is. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow. There are 5 main types of shock. The cardiogenic shock, which is due to heart problems. Anaphylactic shock, caused by allergic reaction. Septic shock, due to infections. Neurogenic shock, caused by damage to the nervous system. And lastly, hypovolemic shock. So first, let me explain the word hypovolemic. Hypo means decrease, and vol means volume, and emic means blood. So together, it means decreased blood volume. Hypovolemic shock is an emergency condition in which severe blood and fluid loss make the heart unable to pump enough blood. Losing about 1/5 or more of the normal amount of blood in the body causes this of losing about 1/5 or more of the normal amount of blood. So blood loss can be due to bleeding from cuts, bleeding from other injuries, internal bleeding, such as bleeding from gastrointestinal tract. My patient is male, an elementary teacher who is 46 years old from Manila to Magadi City. So on November 10, 2020 at 5 p.m., my patient and his son met a vehicular accident in Magadi City. The patient and his son were riding a motorcycle when suddenly a multi-cab accidentally hit them. So the patient's son had minor injuries and bruises, while he had an abdominal trauma because of the firewood that he was carrying at his lap. He was unconscious afterwards and was bleeding internally too because of the great accident. Both of them were then rushed to NOPH emergency room at exactly 6 o'clock in the evening for immediate care. So upon assessment, his blood pressure has dropped, his heart rate and respirations are rapid, and his skin is cool and clammy. So vital signs were taken, so temperature is 36.5 Celsius, pulse rate is 136 BPM apical and it is irregular, so respiration is 38 CPM and it is also irregular, and BP is 90/60 mmHg. Oxygen saturation is 86%, so patient is under the care of Dr. MA with an admitting diagnosis of hypovolemic shock secondary to acute blunt trauma.
The client manifested symptoms of anxiety or agitation, cool, clammy skin, confusion, decreased urine output of less than 30 ml per hour, general weakness, pale skin color, rapid breathing, sweating, moist skin, and unconscious. A physical exam will show signs of shock, which included low blood pressure, low body temperature, rapid pulse, often weak and thread. Stages of hypovolemic shock. Stage 1, you loss of up to 750 ml or up to 15% of your total volume. So your blood vessels narrow slightly to keep blood pressure up, so your heart rate is normal and your body makes as much urine as usual. Stage 2, loss of 750 to 1,500 ml of blood. So your heart rate rises, your body starts to pull blood away from your limbs and intestines and sends it to the vital organs, like your heart and brain. So your blood pressure and urine are regular, but you may feel some anxiety. 3. Loss of 1,500 to 2,000 ml of blood, about half gallon. So your blood pressure drops, your body stops making as much pee. Your limbs are cold and clammy and your skin is pale. You may become confused or flustered. Stage 4, loss of more than 2,000 ml of blood, more than 40% of your total blood volume. So your heart is racing but you feel sluggish. Your blood pressure is very slow and your body is making little or no pee at all. Hypovolemic shock diagnosis. So your doctor will check your temperature, pulse, breathing, and blood pressure. They'll check the color and feel of your skin. Then, if you're awake and alert, they'll ask about past medical issues and your overall health. If you could be in shock because of an ectopic pregnancy or something else related to your reproductive organs, the healthcare team will also do a pregnancy test and ask about your LMP and any recent vaginal bleeding. You may need more tests, including imaging studies such as X-rays, ultrasounds, or CT scans, blood and urine tests, heart tests like ECG. Nursing management. Primary prevention of shock is an essential focus to nursing care. So assessment of the following is vital in hypovolemic shock. First, history. The history is vital in determining the possible causes and in determining the workup. So vital signs. Prior to arrival at the emergency department should also be noted. Trauma. In patients with trauma, determine the mechanism of injury and any information that may heighten suspicion of certain injuries. Major goals of the patient are maintain fluid volume at functional level, report understanding of the causative factors of fluid volume deficit, maintain normal blood pressure, temperature, and pulse. So maintain elastic skin turgor, most tongue and the mucous membranes, and orientation to person, place, and time. Nursing care focuses on assisting with treatment targeted at the cause of the shock and restoring intravascular volume. First, safe administration of blood. It is important to acquire blood specimens quickly to obtain baseline CBC and to type and cross-match the blood in anticipation of blood transfusions. Second, safe administration of fluids. The nurse should monitor the patient closely for cardiovascular overload, signs of difficulty of breathing, pulmonary edema, jugular vein distension, and laboratory results. The third one, monitor weight. Monitor daily weight for sudden decreases, especially in the presence of decreasing urine output or active fluid loss. And lastly, monitor vital signs of patients with deficit fluid volume every 15 minutes to 1 hour for the unstable patient and every 4 hours for the stable patient. Medical management. Emergency treatment measures must include prompt and adequate fluid and blood replacement to restore intravascular volume and raise blood pressure. So, first is volume expansion. Saline solution or lactated ringer solution, then possibly plasma proteins or other plasma expanders may produce adequate volume expansion until whole blood can be matched. Pneumatic anti-shock garment. These counteracts bleeding and hypovolemia by slowing or stopping arterial bleeding, by forcing any available blood from the lower body to the brain, heart, and other vital organs, and by preventing return of the available circulating blood volume to the legs. Treat underlying cause. If the patient is hemorrhaging, efforts are made to stop the bleeding, or if the cause is diarrhea or vomiting, medications to treat diarrhea and vomiting are administered. Lastly, redistribution of fluid. So positioning the patient properly assists fluid redistribution, wherein a modified Trendelenburg position is recommended in hypovolemic shock.